PPDA. At PPDA, we observe the COVID-19 SOPs by wearing the mask, as you can see, by sanitizing, and by having social distancing. But because of this social distancing that is between me and the recorder, around me put off the mask so that I can be audible clearly. The journal PPDA is what I'm going to talk about, which started way back in 2003 by an act of parliament. PPDA was established by an act of parliament of 2003 called Public Procurement and Disposal of Public Assets Act 2003, enforced through regulations. We have the regulations of 2014 that governs the central government entities. We have regulations of 2006 that governs local government entities. The PPDA as an institution regulates public procurement and assets disposal. It falls under the Ministry of Finance. It is governed by the board that is appointed by the Minister of Finance. It has its head office on Nakasero Road, Plot 37. It has district offices or regional offices, one in Barara, one in Mbale, and another one in Guru. The establishment of the PPDA came as a result of challenges that were being faced in public procurement. Before 2003, there used to be Central Tender Board. Central Tender Board had centralized public procurement in Kampala, I would say, because all procurements for all government entities, ministries, districts, referral hospitals, public universities were being procured at the center, Central Tender Board, which was based at Nkurumah Road here in Kampala. So if you want an X-ray machine, for example, in Arua Referral Hospital, then you raise your requisition in Arua, it is procured centrally here. The challenge of that centralized procurement was mainly delays because of the workload that was at the center. Therefore, the reforms, the financial management reforms that spilled over to public procurement required that procurement is decentralized. And decentralization of procurement meant actually that all government entities, ministries, parastatals, authorities, commissions, referral hospitals, districts, municipal councils, cities are responsible for managing their procurement processes themselves. What that means also, organs were put in place where accounting officers were given the overall responsibility, and the contracts committee also appointed from these government entities, what you call procuring and disposing entities. And the contracts committees are staff of these entities, unlike the Central Tender Board, where we had tender boards, say District Tender Board, which was comprised of political politicians, Police Tender Board, not civil servants. The Contracts Committee serve 2 terms. They are composed of 5 members, and one of these members must be a lawyer. Where they don't have lawyers, they benefit from the legal services of Minister of Justice and Constitutional Affairs. The They then established also the procurement and disposal units, who are staffed with professionals. And these are, in the central government entities, these are recruited by civil service and are transferable by Accountant General's Office, which is under Ministry of Finance. In other institutions like parastatals, these are recruited by the organs within those parastatals. In local government, these are recruited by also service commissions, say District Service Commission, and these are not transferable. They are staff of local government or municipal councils, and therefore they are promoted, they report to those organs that recruited them. Then the PPDA, as an authority, was established to provide an oversight, to provide regulatory services to these procuring entities, and also providers or contractors, and also the public, to understand their roles in how to manage the public procurement in this country. PPDA provides advisory services. They work with the Ministry of Finance in terms of policy formulation. We work with again, Ministry of Finance in terms of amending the laws and putting regulations in place. We train and build the capacity of service providers and the public and the entities themselves. Then PPDA also does audits, what we call procurement audits, and investigations related to public procurement. That is as far as 2003, when this organ or this authority was put in place to resolve, to oversee how the decentralized procurement system is managed. In 2003, the first executive director was Agawa Ediga, who served up to 2010 under the governance leadership of the board, which was headed by the chairman, James Kaoza. James Kaoza is a renowned auditor of high standing, and that is the time when PPDA was putting systems in place. The contracts committee were not there, the procurement units were not there, the records keeping were lacking in these procuring entities, and therefore there was a lot. We commend that leadership that really put the decentralized processes or system to start. The recruitment or staffing of staff was made in 2004, and actually that's when I joined the PPDA. The PPDA, generally as a regulator, ensures that public procurement meets the principles, the basic principles of public procurement, which is transparency, which is fairness, competition, which is and delivers value for money generally, and transparency and accountability. And in ensuring that that is done, PPDA provides advisory services in the first place. Entities that are procuring seek advice. We put in place or we harmonize regulations and laws and policies. We also, the PPDA, ensure that the stakeholders in this field of public procurement know what they are supposed to do: capacity building, their capacity is built. If you're a procurement officer, we build capacity to procuring and disposing entities. We also do capacity to providers, service providers. We also conduct procurement audits, instigates complaints. We also ensure that if there are cases of administrative reviews are handled. The public procurement is acquisition of goods, works and services to deliver the service to the citizens. If you are in the process of acquisition of, say, a road, you are actually doing public procurement. Because this road is not a private endeavor, it is going to be used by the public. If you are going to procure health services, say medicine for our medical facilities, you are doing public procurement. And that process entails availing this opportunity to whoever can deliver. Entails soliciting for bids or advertising for this bid opportunity. Entails, actually the first stage is the planning for this, what you are going to procure, if there are works, if there are services, if there are goods, medical services, say supplies. It entails planning for these procurements. It entails inviting bids, people submitting bids being evaluated by the procuring entities. And here I'm talking about ministries, local government, parastatals who are really handling that process, and awarding contracts. The contracts committee within these entities, they will award contracts and also sign contracts. Accounting officer will sign the contract that will bind the government entity and the service provider. And then the contract terms must be fulfilled, and then the entity also fulfills its obligation of paying the service provider. Then in terms of PPDA providing the procurement audit services, there is also a process that we do, because what is the objective of the audit? The objective of the audit is to confirm and establish that the procurement has followed the set rules and regulations. It has also delivered on the intended objective. This procurement has delivered on the intended objective. For example, if it is a health center that was procured through that process I explained, the health center objective is provide medical services to the sick. So what should be in this health center? Is it only the structure? Or we are talking about also having staff, having medicine, and the staff is working, so that if the sick comes to this health center, he can get that health service. So in conducting the audit, we are at PPDA, the audit is conducted within these procuring entities, which involve reviewing the documents of the entities to understand whether the procedures were followed, but also to ensure that whoever was contracted was actually with the right person to get this contract, so that the processes were not manipulated to give contracts to preferred contractors. But also to confirm that this contract actually effectively delivered the contract as was required by a government entity. In the last 18 years, it has achieved a number of things. Capacity building has been built. If you go in public and you ask what public procurement is, they will tell you they know. The citizens know their rights in terms of what the government is supposed to deliver for them. The laws have been put in place. We have Act, we have the regulations, we have the guidelines, we have issued bidding documents, standard bidding documents that guide or standardize the procurement processes. We have conducted audits. We have suspended providers who are not who are fraudulent in procurement practices. The board has put policies. Actually, I also should have told you that under this leadership, under Cornelia's leadership, we had Professor Wanyama as the board chairman, and currently under my leadership, we have Julius K. Shunjisa as the board chairman, who are doing good job in terms of policy guidance. In 2014, the PPDA was amended. The PPDA Act was amended and regulations were put in place. We are again amending the Act. Actually, the President has already assented to the Act. We are working on the regulations. So, generally, I would say we are moving well. But most importantly, maybe before I leave that, we have put guidelines to facilitate participation of the local providers. How can the local providers, Ugandan providers, benefit from public procurement? And we have, in that direction, given them reservation rights, where we say contracts of this value must be only given to local providers, and where we are also emphasizing that 30% of the contracts that are awarded to foreigners, 30% is subcontracted to local providers. But also we have helped our manufacturers through that local content approach, where, for example, textile and clothing materials, medicines, cables and electricals that are manufactured in Uganda, government entities must buy those from those manufacturers. We have also gone through electronic government procurement, automating the procurement process, which is a way to go. IT is the way to go, and we think with that automation, the benefits of efficiency, cost cutting, reduced contract prices, and accountability and transparency are going to be achieved. So we have expanded. I can also mention that we have expanded. In 2015, we opened our first regional office in Gulu. We opened another office in Mbale and Mbarara. Take care of our decentralized services, all our services in those regions, so that we can reach out to the citizens easily. We have expanded workforce from less than 20 to more than 100. We are currently at 118 staff. So the journey since 2003 to today is seeing progress and growth of the PPDA. Our mandate covers more than 380 procuring entities. And the staffing levels, for example, can't make us reach out to all those entities. So the first challenge is coverage in delivering our mandate, especially the procurement audits. Currently, we audit about 40% of the procurements that are conducted in this country. That means 60% are not reviewed to see whether, but we use that sampling to confirm that actually maybe the practices and the processes and the systems are working. But the coverage is we are short, and this is because of also generally the country's low resource envelope. The resource envelope, if you are to distribute it to all the sectors, then you find that is the adequate percentage that we can get. Apart from those challenges, of course, in terms of the system challenges of procurement, which is not institutional challenges, is still the outcry of corruption in public procurement. How can we solve this? How can we involve all the citizens? Say, you, public officer, you are amassing wealth in 3 years, in 5 years. How are you amassing this wealth when you have been working for a short time? But the public at times praise these public officers who is amassing wealth. So we should inculcate a culture of accountability. The other challenge that actually we are getting, especially in civil service, the regular transfer before some of our these staff calamatize themselves with a government entity they are transferred, and these regular transfers, in my opinion, are not healthy. Though those who do it think that if you remain there for long, also you get used, and then the corruption tendencies we have talked about. We are in COVID-19. These are almost 1.5 years with this effect, and it has seriously affected public procurement as well. Especially the first experience where we had to go through lockdown. We didn't know what to do in terms of continuity of procurement. This culture of virtual management of business had not penetrated in Uganda. So we had to think, and it was important that we gained that experience, and now we are using it. We are enforcing or guiding use of online systems. We can now clearly guide, or we have guided actually government entities that procurement shouldn't stop. Generally, the PPDA is moving on. It is the way to go to manage public resources. Procurement is a vehicle service delivery. Procurement shouldn't be seen as a hindrance, but you should go through public procurement to deliver, and that is it. 60% of our budget is spent through public procurement. So, as a way forward, we must enhance efficiency, we must enhance transparency, fairness, value for money. And this is only going to be achieved if we embrace the electronic government procurement and also put rules and regulations that will promote our local industry. Those are my two major priorities: automation and also embracing the local industry, because we are not going to depend on foreigners forever. In terms of the local partners, I want to thank the tripartite that involve the Office of the Auditor General, the Inspectorate of Government, the State House Anti-Corruption, the Nakarima's Office, the IGP, but especially the Office of CID, Grace Akuru, whom we work with closely in the fight against malpractices in public procurement. Without forgetting also, maybe as a priority, as a first partner, Government of Uganda, led by His Excellency the President of Uganda, General Yoweri Kaguta Museveni, for the leadership, but also the Minister of Finance, because my budget, 90% is funded by government, for seeing public procurement regulation as a priority of this country. In terms of development partners, really, without missing words, World Bank has moved with us since 2003 by the up to date, and they have contributed a lot in terms of the regulations, the laws of this country, in terms of the policies, and in terms of implementing, supporting the activities we do. Danida in 2006, it was a short project. We appreciate. Want to appreciate you.
Tusaze emiwendo kugirayo sente kusa MTN Momo. Kati jayo sente ku miwendo egikyasinze okuba egya wansi okuvanga lumu ogwokutaano 221 ate weefunire ne Century Points buli lw'oteekako lw'osindika oba lw'ojjayo sente ng'okozesa MTN Momo. Genda awali ba agenti baffe bonna mu ggwanga oggyeyo sente ne MTN Momo ku bisale ebisaliddwako everywhere you go.